Today's Teach Me topic is fibroid tumors. What are fibroids? Fibroids are benign tumors of the muscle layer of the uterus known as the myometrium. Fibroids afflict approximately 60% of reproductive age women and 80% of women during their lifetime, and consequently are very common tumors. Fibroids have been shown to occur more frequently in women with a genetic predisposition, and they are stimulated to grow by the hormone estrogen, which is found in all women. What are fibroid symptoms? The majority of fibroids don't have symptoms and can go completely unnoticed. If fibroids are asymptomatic, treatment may not be necessary and conservative management is advised. Fibroids may cause symptoms in women depending on their size, the number present, and their location within the uterus. Some common symptoms, depending on the location of the fibroid, include heavy vaginal bleeding, bleeding in between periods, anemia, pelvic pressure, pelvic pain, urinary frequency or difficulty urinating, constipation, pain during intercourse, and miscarriage. There are two major goals of fibroid therapy: one, to eliminate your symptoms, and two, to preserve your fertility. Many women with fibroids are either pregnant or interested in pregnancy. So what should you know about fibroids and pregnancy? The majority of small intramural and subserosal fibroids may not cause pregnancy-specific complications. Intracavitary fibroids may cause some complications like increased rates of miscarriage and abnormal location of the placenta. Large fibroids greater than 5 centimeters of any location may result in complications like increased pain during pregnancy, preterm labor, and postpartum bleeding. Removal of submucosal and large fibroids of any location may be advised prior to becoming pregnant. There are many misconceptions regarding fibroids and treatment. Myth number 1. Is there a medication that can shrink fibroids? There are no medications that shrink fibroids permanently. GnRH agonists, a medication that can shrink fibroids in preparation for surgery, is occasionally used prior to surgery. However, in most cases, fibroids regrow when the medication is stopped. Studies have shown that this class of medication has significant side effects such as hot flashes. Myth number 2. I want a more minimal surgery, so I think a myomectomy is better than a hysterectomy. This is a very common myth. Actually, for women who don't desire future children, the hysterectomy is medically the faster surgery. It has less blood loss and a faster recovery. For women who are good candidates, laparoscopy, a minimally invasive technique to remove the uterus, may even permit an outpatient surgery. Myth number 3. If I choose a hysterectomy, I will become menopausal and age quickly. Absolutely not. A hysterectomy means removal of the uterus only. The ovaries, which control hormone function, can be left intact, meaning this should not result in an early menopause. It should not affect a change in libido or sexual function. It may seem difficult to navigate the numerous interventions out there available for fibroids. At the Women's Wellness Center, we offer a personalized approach to your treatment based on eliminating symptoms, addressing your fertility desires, and empowering you to take control of your health.